A new Commonwealth body managing primary health services across regional South Australia begins operating today. South Australia's 5 Medicare locals have been replaced by 2 new networks, one for the country and one for the city.
Last year, the federal government announced it was replacing 61 Medicare locals with primary health networks. They provide services covering areas like disease prevention, Indigenous programs, maternity, mental health and diabetes. Country North SA Medicare Local has won the tender covering regional South Australia.
Providing they organise their business so that they've got points, effective points of penetration in each region, then they're likely to succeed at least as well as the Medicare locals did.
The new regional body says the changes will better align services with the state provider, Country Health SA.
Our target is to provide better access, better equality across the region so that we're making sure that everybody gets their fair share.
The new body says there'll be no immediate changes to services, with all of the existing programs being run by the state's Medicare locals continuing until mid-next year. It's the third change of the system in recent years, but locals are being assured it will be business as usual.
They will notice minimal change at this stage. It's merely a change of funding body.
The makeup of services beyond mid-next year is unclear, but the new group says changes are necessary.
There might be a high need for a mental health service in one town. In another town, it isn't quite the same need. They might have a need in that town for something else in chronic disease.
It's up to them to make it happen, and I think, as usual, rural doctors will follow that with interest, and if the coordination isn't there, I dare say they'll complain.
The PHN has promised to consult widely to make sure its services meet community needs. Chloe Hart, ABC News, the Riverland.